Welcome to this lesson of blood glucose testing. In this lesson, we're going to discuss the purpose. Why do we do blood glucose testing? Why is it so important to us as nurses? And then next, we're going to look at learning outcomes. What do we want to take away from this lesson? What do we want to learn from it? Uh, After that, we're going to cover the required materials. What do we need to do a blood glucose test? We got to make sure we have everything available and ready to go when we're ready to test our patient. Briefly, we're going to look at technology resources. The technology explosion is incredible, and there's so much out there on the internet that can be accessed, whether it's for teaching purposes, whether it's for learning purposes, whether it's for demonstration, whether it's for our patients. Nowadays, many people go to the internet and to seek medical information. Unfortunately, there are some sites out there that are not exactly correct. So we need to make sure we're aware of what technology resources are out there, and so we can correctly educate our patients. After that, we're going to look at differentiated instruction. We have to make sure we're covering a type of instruction for people with learning disabilities, people with different cultures. So we're going to take a quick look at that. What prerequisites do you need for this course? There are some articles that you're going to need to read ahead of time to prepare you for taking this course. And then finally, with the procedure itself, how do we do a blood glucose test? After that, we're going to do an assessment. We're going to make sure that we've learned what we need to learn. There is a checklist to follow, and that is also attached to this presentation. As a nurse, I have had many encounters with patients that were experiencing either high or low blood sugar, and it can be a very frightening experience. I remember one scenario in particular. I was working in the ER one evening, and we received a call about a resident at a long-term care facility that was being brought to our facility by EMS. And the nurses at that facility stated that the patient was unresponsive and was more than likely having a stroke. A few minutes later, the ambulance arrived, and I was assigned to this patient. He was an 84-year-old gentleman that came in on the gurney. He was totally unresponsive to voice, unresponsive to painful stimuli. Um, so I started a line on him right away. So we had IV access and drew blood, sent that to lab. The ER doctor came in and examined him and ordered a CAT scan because he did show many of the classic symptoms of a stroke. Vital signs were within normal limits. Um, Everything looked good from that standpoint, but he just would not respond to us. So, um, because of the acuity, I went with him to the CAT scan. And when we were in the room, he was in the CAT scan, and technician was conducting the test. One of the other nurses from the ER came running in and threw an amp of D50 to me, and she said, "Push this now." His blood sugar was 39. Um, Amazingly, once I pushed that into the IV and it got into his system, the gentleman woke up, was looking around, was talking to me, wanted to know what was going on and where was he and what happened. And it was just amazing turnaround from being totally unresponsive to sitting up and talking. So we do need to monitor blood sugars and educate our patients who are diabetic to make sure they do the proper monitoring to make sure that such a scenario does not repeat itself. So what is the purpose? Why do we do blood glucose testing? This lesson is going to be presented to nursing students in their first year of nursing. So at that point, we've already learned and through didactic classes what diabetes is. But how do we take care of our patient? How do we monitor the blood glucose? What are the parameters that we're looking at? What is a normal glucose? What is hypoglycemia? What is hyperglycemia? The chart on the side of the slide here will dictate normal levels, high levels, and low levels. So it's important for us to know what those are as we proceed. And as always, what's important to us as nurses is taking care of our patients. The following quote uh, from Genesis 43:9. I myself will guarantee this safety. You can hold me personally responsible for him. If I do not bring him back to you and set him here before you, I will bear the blame before you all my life. So we need to make sure we're taking proper care of our patients always, because they count on us to do that. So when we talk about learning outcomes, we're going to look at, first of all, policy. We have to be cognizant of wherever we're working, hospital setting, doctor's office setting, any setting, they have policies that we as nurses and employees need to follow. So we need to be aware of what the policies are as they relate to the subject of blood glucose testing and make sure we follow those procedures as outlined in the policy. Second, we need to make sure we are also following universal precautions. We need to protect ourselves as well as our patient. So make sure when you're doing these type of testing that you follow such precautions. And then the outcomes from the procedure itself is broke down into three areas: pre-procedural, what do we need to do to get ready to do this test? The intra-procedural, that's actually when we're testing the blood sugar. And then the post-procedural, well, what do we need to do after the testing is done to make sure we complete everything we need to do as far as recording, reporting, and treating if need be. Here we're covering what we need as far as required materials. The blood glucometer with test strips. Now these can vary. There are many manufacturers out there. There are different models available to the patient. Hospitals will have their preference on what they use. So it's important when you're using these to make sure you're familiar with the equipment, make sure you're trained on the equipment. If not, there's manuals that you could follow as far as guidance on how to use them. And very importantly, when we're teaching our patients, we need to be aware of what type of glucometer they're using in the home setting. Preferably, they'd bring that in when they come to see us. So that way we can cover the exact procedure that's used for that type of equipment. Sterile lancets, those are needed to pierce the skin. Again, those will be, they might differ some as far as manufacturer, but the end result is the same. We need clean gloves. We need cotton balls. We'll need either a washcloth and soap or an antiseptic swab. And then we also need sharp container for our sharps as well as a regular refuse container for the rest of the discarded items that we'll be using. Earlier we mentioned technology resources that are available to us and our patients. This is an example here of what can be found on the internet. This is an actual blood glucose testing being done with a Spanish translation embedded into the actual video. Very helpful when we're dealing with patients that are from a different culture, we can use these type of tools to help us teach our patients effectively. As we saw in the previous slide, there is tools available on the internet for multilingual patients or multilingual exposure to patients. Here also is another device, a universal translator that is available to us. So we can use to communicate effectively with patients that speak a different language. There are also, most hospitals have interpreters available. Um, and the checklist that you'll see at the end of this presentation can also be translated and printed out in languages that can be more helpful to yourselves or to patients that you are treating. Prerequisites for this lesson include the following articles that I found interesting, and I hope you do as well. The first one is titled The Self-Monitoring of Blood Glucose, the use of the first or the second drop of blood. Interesting that there's research being done out there as far as which to use the first drop of blood or second. Um, Follow the procedure that you use in your facility that you'll be working, but just be aware that through evidence-based practice, such policies could change as we learn more about how we do these type of tests. The second article is titled Accuracy and User Performance Evaluation of a New Wireless-Enabled Blood Glucose Monitoring System that links to a small smart mobile device. Interesting again about technology and how it's advancing. Um, there are many devices out there now that are Bluetooth enabled, allowing them to talk to the smartphones that we carry or computers in our homes. So again, another article that is very interesting, shows what type of advancements are being made in the technology field. And then the last article titled Non-Invasive Blood Glucose Testing, The Horizon. And this is an article that looks farther out into the future and what's coming in the next years that will be available to us. Hopefully soon gone will be the day when people are poking themselves, causing pain and piercing the skin, which obviously gives a route for bacteria to enter and cause infection. So as this technology comes on board, we can have better care of our patients without the pain, without the blood. So again, a great article, and the purpose is to make you aware that there are advances coming and soon that we need to be aware of. Okay, so we're getting close to the procedure. How do we do this test? What do we need to be doing prior to the test? How do we conduct the test itself? And then how do we follow up and make sure we finish properly as far as taking care of the patient, as far as recording what we found, as far as treatment goes. So we're going to look at these three areas next. So here we are, we're starting with the pre-procedure. This is prior to the actual test itself. So we need to check the patient's record. All right, we need to look for the frequency of the test. How often does the doctor want us to check this blood sugar? Or how often is the patient at home been told to check their blood sugar? The next thing we want to look at is past results. All right, we need to look at how our patient's been doing with the blood sugar. Has it been running consistently high? Has it been running consistently low? Is it fluctuating between the two? What are causing those fluctuations? Okay, so we need to get a little history on our patient, find out how they've been doing. The next thing is we need to look at what are the orders for the treatment. So if we find this high hyperglycemic state of the patient, what's the orders? Is it a sliding scale on insulin? If it's a low blood sugar, what do we do? All right, so we need to know what has been ordered for treatment for the patient before we start the testing. The next thing we're going to look at is the review of their medication record. Right? What kind of medicine is this person taking? Is it a hypoglycemic medication? Is it other medications that affect the blood glucose? And this is an important one. All right, many patients that we see these days, especially the elderly, are on multiple medications. If we're not familiar with how each medication affects the blood glucose, we need to research that and look it up before we proceed. Sometimes the interaction of medication might cause the problem that we're dealing with. So we need to be aware of the medication they're on. Next thing is we need to prepare our equipment. We need to make sure we have everything ready. When you go into a patient's room to conduct a test, you need to do so in a professional manner and have everything you need. You don't want to walk into a room and say, oops, I forgot something. It doesn't send a good message to our patient. All right, so we make sure we have the glucometer. We make sure we have the test strips. We make sure we have the lancets, the gloves, cotton balls, and again, either the washcloth or sterile swab, and sharps containers or container. Once we have that ready, we can proceed to the procedural part. Now, when we're preparing our equipment and we're getting ready for the procedure, we want to inspect the glucometer. We want to, first of all, make sure it's functioning. Make sure you review the instructions if you're not familiar or you haven't been trained on them. Check the test strips for expiration date, and then check the calibration date on the glucometer. Again, if you haven't been trained on how this is done, follow instructions or seek assistance from another nurse who is familiar with the equipment. As you can see in the picture on the right-hand side on the top, there are numerous types of glucometers on the market. Each one has specific ways of operating, so we need to be aware of that again before we take it into the room. The next thing we do want to do when we go in the room is talk to our patient. Explain the procedure. If they haven't had it done, that's very important to explain. If they have had it done, you still need to explain the procedure, what you're going to do. You do that anytime you have a procedure with a patient, and this is one of those times. So elevate the site, check the skin for integrity. We don't want any bruising. We don't want any open wounds on the area that we're going to be using the lancet. We want the skin to be intact. All right. We need to make sure we wash our hands and then put on our gloves and prepare for the procedure. Okay, now we're ready to start the procedure. What we want to do at this point is we want to select a site. Now, there can be multiple sites to choose from. The most common is the finger, although there are alternates, the earlobe, the heel, the palm, the arm, or the thigh. You can see on the slide here, the picture up on the right on the top, or actually it's right in the middle of the slide, showing the different sites that can be used. So we want to rotate our sites quite often. You don't want to go back and keep poking the same site because it's going to cause soreness and over time skin breakdown. So we want to make sure we rotate our sites on a regular basis. Most people, patients that check their blood sugar regularly will be able to tell you what sites they've been using. You want to make sure that you have a warm, moist towel available for those that may have problems with circulation extremities. If the extremity is cool to the touch, one might want to warm that up so it'll expand and open the capillaries and get the blood flow more to the extremity. So hold it now in a dependent position, meaning holding it down so the blood will flow downward. And you want to take the finger and hold it and then use the lancet to pierce the skin, preferably on the side of the finger. Although this picture here shows more on the bottom of the finger, which is fine. Again, we're going to be rotating these sites anyway, so just be cognizant of where they've been using previously and make sure you move to a different site. After you've lanced the skin with the lancet, you want to wipe away the first drop of blood and place a drop on the test strip. Now, again, follow the manufacturer's instructions for how these test strips are to be used. And you can, if needed, if there's not a lot of blood coming after you've pierced the skin, you can milk the finger. Do so softly, gently. You don't want to really bear down and push hard. And then hold the test strip next to the blood and allow the blood to go onto the test strip. You don't want to take the test strip and just smear it all over the drop of blood. Again, that could cause false reading or an error in the glucometer if it's not done properly. So again, any questions, check the instructions or follow the training that you received at the facility in which you're working. Apply the cotton ball to the site and instruct or ask the patient to hold that for you until the bleeding is stopped. And then insert the test strip into the glucometer, again, following instructions, and allow the glucometer to read the test strip in order to get the results. After you've inserted the test strip into the glucometer, wait the required amount of time for the reading. Normally it does not take long at all. And then dispose of the lancet in the sharps container and then dispose of the remaining material in the proper containers in your facility. Post-procedure, you need to wash your hands and then you need to document your readings in the patient's record. Again, as we spoke earlier, if there are medications that are prescribed for hyperglycemia, if your test reading comes back high, follow these orders and administer the medication as prescribed. And as always, before you finish anything, you need to reassess your patient. So in this case, we're going to do the same thing. We will ask our patient how they're doing, make sure they're no longer bleeding from the puncture site, and offer comfort to them as needed. At the same time, you can share your readings with them and discuss with them the treatment plan based on the reading that you received. Education at this point is always an opportunity to give. So if there are questions about what's going on, if it's a patient who has newly been diagnosed as a diabetic, these are great opportunities for teaching. So answer any questions, provide literature that your facility might have, or refer to a specialist with question or answers to more in-depth questions. At the conclusion of this lesson, we're going to assess how well you as student nurses will be able to test blood sugars. So we're going to work in the skills lab for the remainder of the day. In the afternoon of the second day, the testing will take place. You have until then to prepare yourself and practice what we have just covered. Use the checklist that's attached at the bottom of this, at the next slide, to prepare and follow the checklist. It takes you step by step through the procedure that I have described. If additional lab time is needed, it is available. and one-on-one instruction is also available. You can retest at any time until you are successful. Here is a link to the testing checklist that you will use to prepare yourself for the assessment. It also is available in other languages upon request. So this concludes our lesson on blood glucose testing. We have talked about the purpose, why we do this. I illustrated a good example of the gentleman in the ER who came in unresponsive because for some reason his blood glucose was not checked, and could have been prevented by simply giving this gentleman something to eat, perhaps, or other forms of glucose that are available for someone whose sugar is dropping. We also looked at the learning outcomes. What are we going to take away from this lesson? Mainly, how do we test the blood glucose on our patients? We looked at the required materials, and again, be cognizant of the fact that there are many different glucometers on the market today, and more of them coming. So be aware of that, and if you are presented with one to use and you're not familiar with, look for the instructions, or again, get training on that piece of equipment before you use it. Technology is just exploding, and this is a very important part of the lesson. We need to be aware of the technology that's expanding in this field, in the medical field, and especially as it relates to the blood glucose monitoring. The article about technology that's coming down the road where there's no more invasive part of the procedure, no more sharps, no more poking the skin, no more pain or bruising. So those things are important to definitely be aware of. The differentiated instruction, again, this is available to students in other languages that can be translated. Prerequisites for the course, we covered the 3 articles. Interesting information is available again out on the internet. Evidence-based practice drives what we do, and we need to continue to read such articles and be aware of the changes that are happening in the medical field. The procedure we covered from all 3 parts: the pre-procedural, as we get ready, make sure we have all of our equipment, make sure our patient is aware of what we're going to be doing and how. The procedure itself was covered, and then the post-procedure, where we look at recording our results, informing either doctor and patient of those results, and then if there's a need, providing treatment to alleviate any type of abnormalities in the sugar level. The assessment you will conduct in the lab. You will be given ample time to practice prior to the assessment, and then if there is additional time needed after the first assessment, that will be provided to you. The procedure checklist on the link is provided to use as you prepare for the assessment, and it will be used as a grading purpose during the assessment. So this concludes our lesson on blood glucose testing. Thank you.